Pulse Protocol is the smart path to medical travel.
Hi, everybody. I'm Joan. I'm one of the coordinators with Pulse. I'm a retired nurse and nurse practitioner. I have about 26 years of experience in surgery and family practice. And now I work alongside Pulse as a coordinator doing medical tourism. And we have Dr. Max with us. And we're going to discuss some typical questions that patients ask. And then Dr. Max is going to give his expert opinion on that.
Very nice. Well, welcome everyone. This is we have created this webinar especially for all of you who have a lot of probably questions regarding your health condition, and we want to let you know that we're there to take care of you, and we want you to find out more about us. I'm an orthopedic surgeon. I practice in Puerto Vallarta, Mexico, which is at the central coast of Mexico, right along the Pacific Ocean. And I have been there for 22 years. I'm a son of Canadian American immigrants that came down to Mexico back in the 60s. So I kind of grew up in Mexico, did all my undergraduate work in Mexico, and I did my postgraduate work a year in Texas and then 2 years in Germany. And I'm back in Mexico since 2001, doing medical tourism and taking care of a lot of people regarding their orthopedic problems.
Okay, fabulous. So I have, Dr. Max, I have about 10 questions. So I'll just go through each question, and then if you just want to answer them to the best of your ability, that would be awesome. This is in no specific order, but these are just common questions that come up from patients that might help to for them to understand the surgery and process and medical tourism a little bit better. So number one is, do I need surgery? So how do you qualify a patient?
Well, many patients go through the process of questioning themselves that they really need surgery or not. And obviously they need to get professional advice for them. And I always present to my patients three options. I present to them option A, which is a non-surgical conservative treatment of their problem. And I can tell them the pros and cons about plan A. I also tell them about plan B, which is an intermediate step between non-surgical and surgery, which will require further explanation down the road. And plan C will be surgery. When a case needs it and the situation has come to a point where nothing else helps, surgery obviously will be a good option.
Okay, great. And what are the risks and benefits of surgeries and possible complications that you typically see?
Okay, well, like with all surgeries, there's always a risk of some kind of complication showing up. So what we do is we make sure that we try to prevent those situations. The most common type of complications are infections, blood clotting, and complications due to underlying health issues that a patient may have.
Right.
So we do a pre-surgical evaluation of a patient, do the necessary pre-surgical studies,
Right.
and then during surgery, we provide sterile conditions to do the procedures. We provide with antibiotics, IV antibiotics upon hospital admission, and those antibiotics are taken throughout the recovery period. We also like to give some kind of blood thinner, especially during surgery and after surgery, for any of our orthopedic procedures to prevent blood clotting. The good thing about our practice is that we do, our approaches allow us to make patients stand on their feet the day after surgery and start physical therapy right away. So that cuts down the time they're laying in bed.
Right. So that for patients that are nervous about surgery, the risks and the complications are relatively rare, wouldn't you say?
That's correct. Yeah. Yeah. And if any patients comes in and we see that they need to be further cared by cardiology or by internal medicine, we make sure they get that kind of treatment first before we take them to surgery. But that's a very solemn situation. Most of our patients are basically healthy patients. They're people who are out there wanting to do things with their lives, but they have a joint or they have a back issue that doesn't allow them to do everything they love to do. But they're basically very healthy patients.
Right, excellent. And then if a patient wants to find out how much surgery is going to cost them, what's that process like? And what would you say is the typical cost versus say United States and Canada, which are most of our patients?
All right, well, in Mexico, we can provide affordable prices due to 3 reasons. But before I come into that area, I'd like to mention that we're doing exactly the same procedure, same
Yes.
type of implants as they will get in the US or any other country in the world. I was trained in Germany, and I combined both the best of the American type of surgeries and the European type of surgeries. So we use worldwide accepted, well-known implants. And the reason we can do this kind of procedures in Mexico for a lesser price without diminishing quality is due to 3 reasons. One, of course, our overhead cost is not as high as other places. Second, the prostheses and implants are shipped directly to us from the manufacturer, with not all of us intermediate people marking up the price. So we get them directly shipped to us. And number 3, I think that's the most important thing about Mexico is we still have great doctor-patient relationships, and we work out things with good communication and talk about patients' expectations and be very clear about what to expect from the outcome of the procedures. So we don't have any real legal situations that have gone on in our practice for decades. I actually, if I compare what I pay for malpractice insurance, that it's required by law, but I haven't had to use it for 18 years, is that I pay about $600 a year in malpractice insurance premiums, whereas my colleagues in the US have to pay $60,000 or more to open up their door and be able to see patients. So we pass those savings on to patients. That's why we provide more affordable prices. And our prices range maybe to half or 1/0 what may cost in the US to do those procedures. And I do 9 different procedures on a very common base. So we could talk about costs as we go along.
Yes. And I think, Dr. Max, you're also very transparent with patients. Like, you're very upfront about costs. So there's no surprises. Like, sometimes in the United States, there's added cost and you kind of really don't know what something's going to cost. But Dr. Max is very upfront and transparent about, out the door, what you're going to be charged. So I think that's very appreciated by patients.
Right. And we do have communications weeks and sometimes months before a procedure, before a patient decides to come down and get their surgery done. So we can kind of become familiar with each other. And we do give a whole outline of what's included in a surgical package, because that's what we offer. We offer surgical packages, and that's what we do. Patients will not have surprises as they exit the hospital that additional charges were done, unless there was complications that require some other type of care. But we knock on wood, we haven't had those kind of complications. And basically the care can be given within that surgical package.
Right. And that also includes transportation to and from the airport, visits, support staff. And Dr. Max has awesome support staff, folks that he's been working with for years. So whether it's physical therapy or the other doctors,
follow-up care,
follow-up care, he has a whole team of people. And, they're awesome. And that's included in the price as well.
That's correct. And all of that's outlined when we're doing our different communications with patients. We put it in writing so they know what to expect. But we also add like the walkers and the different devices that they may need for their recovery, and consultations, in-house physical therapy, in-house medical visits by my staff if it's required. So all of that included within the surgical package.
Right. In very good hands with Dr. Max and his team. So, okay, the next question is, I get this a lot, is what approach do you use? So, and that this obviously varies, but depending on, you know, if you want to give examples for different types of surgeries, if you're doing a total hip replacement, a total knee replacement, what have you, patients like to know what kind of approach, surgical approach you're using.
Sure. So that's also a concern because that can influence on your recovery time. So what we do very anatomical approaches. Basically, we just cut the skin and the underlying tissues, and then we work our way into the joint by moving the muscles to one side. We don't cut muscles, we don't cut tendons, we just work our way in so that we can get to the joints. Some procedures are minimally invasive, like arthroscopy procedures, where I just do 2 portals to go inside the knee and fix up the internal structures of a knee. Same as in some shoulder procedures where I just do 2 or 3 portals, and those are very small incisions. But any open incision, I try to go through the most less, I would say, the less damaging type of approach, the one that can get to the access to the joint without affecting vital structures. For example, in the hip joint, I go through what we call the anterolateral approach. We go through the front a bit to the side to avoid a little tiny nerve that goes right in front of a femur. So we do an anterolateral approach. I have been doing this for 22 years, whereas just recently, doctors, surgeons in other parts of the world are changing from posterior approaches to now anterior approaches, and we have been doing this all throughout the practice. The same for the shoulder rotator cuff type of surgeries. We go right through the front part of a shoulder, a little bit to the side, and just get down into the area where we find the spurs and the tendons that need repair. And in the knee area, when we have to do a total knee replacement, we also go through the front and do just enough of large incision that may be needed for the joint replacement. So for the knee, we do a small anterior incision to approach the joint so that we can implant the prosthesis. And for the back surgeries that we're doing, I just go straight in through the back without having to go through the front, without having to disturb the organs in the abdomen, without having to push the liver to one side and the kidneys to one side to get to the back. I just approach it directly from the back.
Exactly. Excellent. And then what type of implants do you use, or if patients have a specific request, are you able to order those implants for patients?
Okay, well, I use only FDA approved implants that are made by recognized manufacturers in the US, or I use Western European implants that are recognized by the European committees of certification and validation of implants. So there's many implants out there in the world. They're made, some of them are made in other places of the world, I should say, other latitudes that are not very trusting. And of course, some are competitors in some parts of the world can offer those implants at a lesser price. But at the same time, there's no long range type of studies done on those type of prostheses. There's not a backup, the scientific backup that those implants are going to be working for a long time. The exterior aspect of an implant can look the same, but inside you want to make sure the metallurgy and whatever the components are made of come from very pure sources.
So Dr. Max, about how many years have you been in practice, and approximately how many surgeries have you performed?
All right. Well, I have been an orthopedic surgeon since 1998, but not taking into account the 6 years of training I did beforehand. I have been doing this for now will be 22 years as an orthopedic surgeon, and have done. We kind of now lose the numbers, but I would say about 4,000 total knees, 2,500 or maybe almost 3,000 total hips, thousands of rotator cuff surgeries, knee arthroscopies, shoulder arthroscopies, and back surgeries, I would say about 1,800.
Fabulous. Thank you. And how do you manage post-op pain for patients?
Well, we know that we all respond differently to pain, and we want to make sure that our patients are not overreacting to the medications that we're giving them for pain. So I have a very good team of anesthesiologists that they also are providing after surgery pain management. So we try to find the right dose and the right amount for every patient. We use whatever patient needs, from non-narcotics to narcotics when they're needed. And we also put them on some type of infusion pumps where they're dripping anesthesia throughout their recovery. Or they may have also IV medication that will help them get through the first few days at the hospital. Once they're discharged from a hospital, they continue on oral medication and occasionally on some intramuscular type of pain management medication.
Excellent. Okay. And typically, what is the recovery process like? I don't know if you want to pick a procedure that you do a lot, like a total hip or total knee. What can patients expect?
Well, when I first graduated from my training as an orthopedic surgeon, when I came back from Germany, back to Mexico in 1998, well, I used to do like 50 different type of procedures. Now I have brought it down to doing mostly 9 procedures. I am mainly a joint surgeon, but I'm also doing back surgeries with assistance of neurosurgeons that come into the OR with me to take care of the nerves while I'm doing the orthopedic part of a procedure. So I'm down to about 9 procedures. I'm mainly doing joint replacements. Joint replacements take about 2 weeks to recover from the immediate post-operative type of situations that they may face. They are walking from day one,
Yes.
but I would say that they're getting back to their normal life about a month later after a knee replacement or a hip replacement. When we're doing a rotator cuff surgery, I see a lot of rotator cuff ruptures, and they take a bit longer because the tendons have been ruptured. So I suture them back together. I need to put them in a shoulder brace for about 3 weeks, and then they take about another 3 weeks for them to get back to doing their normal activities. Now, some patients are lucky that their tendons have not completely been ruptured, so they can go back doing some of their normal activities 2 to 3 weeks after surgery. Knee arthroscopy is another procedure I do a lot for meniscal damage. They don't even have to stay overnight, and they can go back doing their sports and normal life about 3 weeks after surgery. And back surgeries, they do take sometimes a bit longer, any place between 4 to 8 weeks to completely recover. And I have a rule of thumb: for every year a patient has had a back issue, it takes a month to recover. So some people who have had nerve compression for 20 years, it may take even up to 20 months to recover. Back surgeries are the ones that the outcome are not as fast as joint replacements, but once they get through the stages of recovery and they build up their core muscles and they do their therapy, eventually they can go back doing the things they love to do and back to their work and to their life that they used to have before.
Great. Excellent. What type of anesthesia do you typically use in surgery?
Okay, well, our anesthesiologists are well trained to do from nerve blocks, regional blocks, epidurals, and general anesthesia. When I do procedures that are below the waistline, many of our patients only need an epidural and a mild IV sedation to get through the procedure. When it's something like in the shoulder area or in the neck area, then we have to do general anesthesia.
Yes. Excellent. Okay. And how do patients schedule surgery? And what is your typical availability for procedures? How far are you booked out?
Well, we do have a system where people take in the call and start making notes about what the patient needs. Eventually, a telehealth conference can be set up or email communications are set up where I personally get involved. We start reviewing the patient records and whatever images that they can gather or medical notes that they can get. And I want to make a note on that. If for some reason patients do not have access to their records, I don't want them to worry about it, because when they come to us, we will complete their files with whatever they need to do. Many times I do studies, and let's say someone said, well, I had an MRI done about a year ago. Well, when they come to our practice, we do a new MRI, and that can be done with short notice, because the hospital caters to us, and whatever comes from my office, they take care of it right away. So I don't want patients to be concerned about not getting all their files together before they can get there. Whatever they gather from their doctors or health providers, it's helpful to give us some helpful hints of where we need to go. So after we kind of set up a communication line with patients through our email or through the platforms, we can schedule the procedure. I need about, ideally, 2 months advance notice, but I have been able to schedule patients within a 2-week window period. Because I take care of a lot of local patients, and I have about 3,500 local patients established. So with the local patients, I could shift some things around to accommodate for those patients that are coming from someplace else. We do work 5, sometimes 6 days out of a week. I have a huge team that helps me out. I have 9 people that help me out to set things up. I perform the surgeries, but then others help me with a follow-up, and I'm supervising the whole process while patients are recovering from their surgeries. So any place from 2 weeks to 2 months, that's the time period I need so that we can set things up for our patients.
Great. Okay, and then like the final question is, and I know this will vary depending on the surgery, when can I travel back home and when can I get back to regular activities? So how long do you want patients in Mexico before they can travel back home, and when can they get back to activities?
All right, well, for any major procedure, we recommend patients to stay at least 2 weeks so that we can do adequate follow-up care in their hotels. I mean, after they're discharged from the hospital, my follow-up team will go to the hotel to do bandage changes, physical therapy, medical assistance of any kind they may need for their recovery. So any major procedures like joint replacement, like a hip replacement or total knee replacement or back surgery, we like patients to stay at least 2 weeks after surgery. So a total of maybe 16, 17 days. For minor, less or minor procedures, I should call them, for minor procedures, like rotator cuff surgeries, knee arthroscopy, shoulder arthroscopy, any place between 5 to 7 days after surgery, that's sufficient time so that we can take care of our patients for their follow-up care. So that's more or less time frames.
And then when can they get back to activities? Like say if someone's fairly active and they want to get back to the gym, when can they do?
It all depends how much muscle atrophy they have developed. Some people, when they postpone the procedure for such a long time, then they need to work, like say someone that had a knee replacement, a person who is perfectly fit with good muscles, they can go back doing their activities within a month. But let's say that they develop atrophy because they kind of postpone their procedure for 4 or 5 years. So obviously one side of a body is going to get stronger than the other side. Then the part of a body that takes most of a weight is going to have really good muscles, and the affected side that was not being used that much because of a limitation of a joint probably has developed muscle atrophy. So muscle atrophy is something I can't fix with my scalpel. That has to be done through physical therapy and a whole training program. And once their muscles are equivalent on both sides, that's a time frame, that's a time period when they can go back doing sports. That's a rule of thumb. Your muscles have to be the same on both sides, and then you can go back and play sports.
Okay, great. All right. Well, those are all the questions I had, Dr. Max. Thank you. Do you have anything else you wanted to add?
Yeah, sure. Well, we want patients to feel at home, away from home. We follow international standards in our practice. Our hospitals have state-of-the-art equipment. We have really nice, large operating rooms where I can set out all the options. I customize the implants to the patient's anatomy. I always have several options that are available. So when I'm in there, even though I'm already prepared to go in there and I know what I'm expecting, I like to always fit the implants to what the patient's anatomy will accept. So
Yes.
I have all of these tables that are open and they have ready to be, whenever I need something, I can just point over my finger and request it, and the implant that fits the patient's body the best, that's the one that we use. So
Yes.
we do use very well accepted prostheses that have passed the proof of time, that have been for many years, they have been proven to be the best, that we don't have any recalls on them, and
Right.
that this is something that I would do for a family member. So we like
Exactly.
we like to treat our patients as if they're part of our family.
Yes. Excellent. Well, thank you so much. Appreciate your time and answering all these questions.
Thank you, Joanne. Thank you for your assistance with our patients as well. You have
Yes.
a nice holiday.
You too.
Thank you.